More than 67,000 new cases of bladder cancer will be diagnosed in the U.S. alone this year, and it can easily be fatal if surgery isn't done to remove the organ. Now, as Melissa Vade shows us, doctors have a new option in doing that.
There's a new way to do urological surgeries that is saving patients pain and time. St. V's is now one of 35 medical centers in the country using a new robot called Da Vinci. When 67-year-old Jack Murray started noticing blood in his urine, he initially thought it was an infection, but further testing found it was much more serious.
So he went in to scrape it and found a tumor.
Cancerous tumors, like Jack's, require the removal of the bladder through a 1.5-foot incision. But Dr. Ronney Abaza offered Jack a new procedure that removes the bladder through a 3-inch incision using a new robot called Da Vinci. For Jack, there was no question.
This would be the most comfortable for me, quickest recovery, less chance of infections, stuff like that.
Dr. Abaza says substantially fewer complications. There's less blood loss, a 3-day hospital stay as opposed to a week.
From my experience with these kind of procedures, the patients typically want to go back to work in a week. We usually don't let them, but they usually want to go back to work within about a week.
Here's what makes the surgery work. The robot doesn't do the procedure. Dr. Abaza simply uses it to make steady, more precise cuts. The bladder is then taken out through the small incision, and the urine will be rerouted to an outside collection bag.
I can do an operation with chopsticks, but I can also do the same operation with a fork and knife. Which one would you rather have? Obviously, you'd rather have the much more precise instrument, and that's what the robot gives us.
By having a surgery done this way, Jack avoids the 6-week recovery he faced with the other procedure. The Da Vinci robot is also used on prostate and kidney cancers as well, and at a cost of $1.5 million, you'll see it applied to many other surgeries as well. Melissa Vade, News 11.
New at 5:30, a state-of-the-art surgery, and St. V's is one of the only hospitals in the world to offer it. Today, St. V's performed its first operation with the new technology. NBC 24's Kylie Conway joins us now live with how the surgery went from the eyes of the surgeon and the patient.
35 medical centers in the world to have the technology to perform minimally invasive bladder cancer surgery. Today was the second surgery, but the first look at this new method. The Da Vinci robot system cuts 4 tiny incisions, a 1/2 inch or less, to insert the robotic arms and the ports, and then 1 3-inch incision to remove the cancerous bladder. In an open surgery bladder cancer operation, a 1.5-foot incision is made. So this new technology allows for speedy recovery. Typically, the patient is on their feet within 24 hours and is back home within 3 to 5 days.
So one example that I give the patients is that I can do an operation with chopsticks, but I can also do the same operation with a fork and knife. Which one would you rather have? Obviously, you'd rather have the much more precise instrument, and that's what the robot gives us.
According to the American Cancer Society, more than 62,000 people will be diagnosed with bladder cancer this year. It's the 4th most common cancer among men and the 9th among women. Coming up at 6 o'clock, you'll hear from the patient before he goes in for surgery, and you'll also see through the eyes of the doctor as he performs the state-of-the-art procedure. Reporting live, Kylie Conway, NBC 24 News.
Live from Toledo's most accurate weather station, you're watching NBC 24 at 6 with Jim Blue, Shaniqua Stratford, Blizzard Bill Spencer with the Storm Team forecast, and Eric Haubert with sports. NBC 24. Fair, accurate, honest.
A rare opportunity to go inside the surgery room and observe a brand new method for bladder cancer surgery.
Now, St. V's is one of 35 medical centers in the world to offer this robotic operation. NBC 24's Kylie Conway joins us live to tell us more about it. Kylie?
Jim and Shaniqua, today was the second surgery of this kind to ever be performed at St. V's. Jack Murray was the brave patient that went under the knife. Before the operation, he said he's grateful for the Da Vinci robotic system.
It'll be a little chilly where we're going, so we'll get you some warm blankets and get you all settled in, okay?
Jack Murray was diagnosed with bladder cancer in July. It was too advanced to treat, and he had to have surgery.
From where I got out of it is this would be the most comfortable for me, quickest recovery, less chance of infections, stuff like that. So
Here's a look inside the surgery room. Controlled by Dr. Ronney Abaza, the robots cut 5 tiny incisions. The largest is 3 inches long.
So one example that I give the patients is that I can do an operation with chopsticks, but I can also do the same operation with a fork and knife. Which one would you rather have? Obviously, you'd rather have the much more precise instrument, and that's what the robot gives us.
St. V's paid $1.5 million for this tool 4 years ago.
So it's not cheap for a hospital to buy this system, but because of St. Vincent's foresight into purchasing the system, it's allowed us really to take it to new heights.
Within the last year, 7 new procedures were done with the Da Vinci. Luckily for Murray, bladder cancer was one of them. In his eyes, a great alternative to open surgery.
Yeah, there's a longer recovery, longer stay in the hospital, more chance of infection, more pain. Wasn't hard to decide.
Compared to a week's stay in the hospital and 4 to 6 weeks of recovery, Murray should be out of the hospital in 3 to 4 days, back to work in 4 weeks, and could be walking by tomorrow.
Then I'll try running the next day.
According to the American Cancer Society, more than 67,000 people will be diagnosed with bladder cancer this year. It's the 4th most frequent cancer in men and the 9th in women. Reporting live, Kylie Conway, NBC 24 News.
Wow, it's quite a development.
Technology, I'll tell you.
In our health alert tonight, tens of thousands of Americans will be diagnosed with bladder cancer this year. Well, a robot is helping one Toledo doctor perform less invasive surgery in removing a patient's bladder. Here's 13 ABC's Susan Ross Wells.
Bill, St. Vincent Mercy Medical Center is one of about 3 dozen hospitals in the world to use what's called the Da Vinci robot for this surgery. We were there this morning as one of the hospital's first patients went in for the procedure. 67-year-old Jack Murray hasn't lost his sense of humor as he prepares for a major surgery. But it will be less major than it could have been thanks to something called the Da Vinci robot system. Jack has bladder cancer, and this morning Dr. Ronney Abaza removed the bladder and the lymph nodes with the help of a surgical robot. One of the major benefits for Jack, small incisions rather than a large cut.
The patients are in the hospital about 3 days, never in the ICU, never intubated overnight, and the blood loss is on the order of 1/10 of the open surgery.
Recovery time's a lot quicker, a lot less pain and discomfort, less chance of things going wrong on the way.
Diagnosed in early June, Jack's tumor has already been removed. The doctor says today's surgery is to prevent the potential spread of cancer. Back in 2003, doctors here began using the Da Vinci robot for prostate removal. 13 ABC Action News was there for that surgery, too. Dr. Abaza says prostate removal is the most common procedure done with Da Vinci. The bladder removal is relatively new and a complex procedure. Jack's surgery is only the second one done at St. Vincent with Da Vinci. Jack calls his doctor a pioneer.
Glad it's here now. Yeah, it makes it a lot better.
The doctor says surgery takes about 5 to 7 hours, the same as the traditional surgery, but he expects they will eventually be able to do it faster than the standard open procedure. Diane, back to you.